Thanks for joining us. Coming to you live from Seoul, I'm Han Da-eun. Today, September 10th, marks World Suicide Prevention Day, a day dedicated to raising awareness about suicide, promoting prevention efforts, and supporting those affected by it. Over 700,000 people die by suicide each year, with South Korea having the highest suicide rate among advanced economies. The suicide rate in the United States has also reached a historic high, sparking urgent calls for effective prevention strategies. In today's episode of Within the Frame, we explore recent suicide trends, proactive prevention methods, and what more can be done to combat the rising numbers, focusing particularly on the situation here in South Korea. Joining us now via Skype is Dr. Hee-Yeon, director of the He Counseling and Coaching Center. It's great to have you with us.
Thank you for having me.
We're also joined by Michael J. Bernstein, professor of psychology at Penn State Abington, who is with us from Pennsylvania. Welcome to the program.
Hi, thank you so much for having me.
All right, Dr. Chu, let's start off with you. So South Korea showed the highest suicide rate among OECD members in 2022. And according to a local survey, deaths by suicide from January to May this year rose by 10% from the year before. What do you make of this? Are enough measures being implemented?
Yeah, it's unfortunate that despite multiple efforts to prevent suicide, having this high suicide rate, I think, reflects a serious and ongoing mental health crisis in Korea. And I think this serves as an evidence that current prevention measures are not enough and needs to be reassessed and refined. To reduce the suicide death rate, I believe we must enhance our approach in three key areas. One is suicide prevention, also harmful content protection, and promotion of mental health well-being. Currently, many public campaigns and education programs are being offered, but they are overly simplified. Often they rely on one-way lecture or one-size-fits-all approaches to all sorts of groups. This doesn't fully address the complexities of different age groups or contexts. So therefore, these initiatives need to be tailored to meet the specific needs of various populations. Also, protecting vulnerable individuals from harmful online content is important. Algorithms on digital platforms can expose people who are already at risk to harmful suicidal contents. This can include specific and detailed suicide methods or a call for a suicide pact. And there's a shocking stat between 2019 and 2023, reports on harmful suicide-related online content surged almost ninefold, from 30,000 cases to 300,000 cases, according to Ministry of Health and Welfare. So we need also stricter digital safety measures. Lastly, we also need greater emphasis, I believe, on promoting mental well-being. We need programs such as stress management and resilience building, also campaigns to reduce mental health stigma. I think this can help encourage people to have open conversations about mental health and therefore preventing crises before they escalate.
The number of deaths by suicide in Korea in the first 5 months of this year has already surpassed 6,300, which signals that South Korea's alarmingly high suicide rates could increase even further this year. So, as you mentioned, we're going to definitely need more effective measures, more specific measures for different groups of people. Now, Professor Bernstein, the U.S. saw the highest suicide rate last year, with the figure surpassing 50,000, according to the U.S. Centers for Disease Control and Prevention. What's behind this?
It's a great question. Suicide and suicidal ideation, or thinking about suicide are unfortunately all too common. There are lots of causes of this, and largely they focus on a handful of factors, and one of which is people not seeing hope, not believing that things can improve. One major cause of suicide or suicidal ideation is loneliness. This is my area of scholarship. Is people need to feel connected to others. We need to feel like we belong. And when we don't, this can lead to really challenging emotional states and really negative impact on our well-being. Loss of life meaningfulness is another factor when people feel as though their lives don't have meaning. The COVID pandemic led to considerable social isolation, as well as quite a bit of economic hardship and loss of jobs. And people derive often a sense of meaning from their jobs. And so the last several years, of course, suicide and suicidal ideation was an enormous problem before the COVID pandemic. But I believe that the COVID pandemic and the ongoing nature of it are contributing significantly to those statistics now. Another thing in the United States and other countries as well has to do with diverging politics. Many people on both sides of the aisle in the United States feel as though the country that they knew is moving away from them. And this can lead to a sense of a lack of social connection and a loss of meaning as well. And so all of these factors likely relate to the increase in suicide rate in the United States in recent years.
And many reports indicate that youth suicide has increased significantly in the U.S. It seems there's a kind of distress that's toxic to young people that previous generations did not face. And as you pointed out, that those could include sense of hopelessness and loneliness. And we should all try to stay connected, and we can never stress that enough, right? Dr. Chu, the average age of Koreans who died by suicide was 44 years old. How do you analyze suicide rates and patterns by age groups?
The statistics, I think, shows that suicide affects people from all age groups, from all stages of development. According to a recent psychological autopsy of people who committed suicide, shows people from different age groups committed suicide due to or related to different stressors. So young adults who are below 34 reported their major stressors were related to career pressure and unemployment. Adults who are between 35 and 49, their major stressors were analyzed to be financial burden and work stress, especially related to interpersonal relationship. Adults also between 50 and 64, their major stressors were job loss and retirement. People above 65, they reported the major stressors were social isolation, chronic illness, and depressive symptoms. Something that was missing from this data, but according to other sources, teens, major stressors were related to mental health issues and relationship stress. So you can see that different age groups have their unique and distinct stressors that can potentially contribute to suicide. Therefore, as I mentioned before, in order to have effective suicide prevention strategies, we must address these unique challenges across different age groups.
So major stressors, as you pointed out, of course, vary among different age groups, but it seems that jobs, difficulties with jobs, financial status, trouble in personal relationships sound like some of the common reasons, the common forces that drive people to take their own lives. Now, Professor Bernstein, South Korea's latest suicide data reveals that more men died by suicide than women, with individuals living alone at higher risk. What factors might contribute to this trend, and are we seeing similar patterns in the U.S.?
This is another great question. And yes, we're seeing the same patterns in the US. So people in single person households definitionally have less social connection than people who live together. So they are less connected by virtue of just they live by themselves. This has then two impacts, one of which is it makes it unfortunately easier to engage in self-harm. It's less noticeable when people are behaving differently or giving off signals that they might be thinking of hurting themselves. So there's been a shift in the way that they are experiencing the world. So you have both fewer people around to notice a problem, and people have easier access because there's no one who's living with them who can stop them if they decide they're going to attempt self-harm behavior. Men also tend to have fewer close social connections than women do. And this means they have fewer people to talk to when they need help. And also there are fewer people to notice when they need help. And additionally, men tend to be less comfortable or less willing to talk to others about their feelings, particularly those related to sadness, as these emotions are perceived as not stereotypically masculine. Again, that is not that there is no reason to think this. Men experience sadness, women experience sadness, but men tend to be less comfortable talking about it with others, and as a result are less willing to share that they are having these concerns. All of these make men more likely to engage in self-harm behaviors, and then people living in single person abodes also more willing or more likely to self-harm.
I hope more men can come to realize that it's perfectly normal to reach out and talk about it. It's perfectly normal. There's nothing wrong with reaching out and having an open conversation about their difficulties. Now, Dr. Chu, nearly 97% send warning signals before they take their own lives, yet only about 24% of these signals are recognized, according to the government's latest survey. What are some common signs of suicide, and why do so many people fail to notice them?
Some common signs of suicide can include verbal cues. It could be a direct expression of suicide, such as, I want to die. It can also be a slightly indirect cue, such as, my family would do better without me. Other signs include behavioral signs such as self-harm or giving away personal belongings, saying goodbye to people, social withdrawal. Also, drastic mood changes can be a sign of suicide. In emotional states such as hopelessness, depressiveness, anxiety, rage, all these can be relevant to warning signs of suicide. As you mentioned, many people, however, fail to notice these suicidal signs. I think one reason may be a lack of awareness. The recent statistics in 2023 show that 47.7% of people believe suicide can occur without any warning signs, which is not true, but this majority of people, many people, are lacking awareness of recognizing the suicidal signs. Another reason may be a subtlety of suicidal warning signs. For example, something like social withdrawal can be misattributed to like work-related stress or other reasons because these signs are quite ambiguous. It can so therefore like something like social withdrawal and drastic mood changes, the severity and the cause can be attributed to different issues such as mental health issues or suicidal warning signs, and oftentimes people have or people struggle to identify them as suicidal warnings. Another reason may be minimization. of the warning signs. When people say like, I want to die, some people minimize it as like, oh, it's probably one of the ways to exaggerate how stressed they are and just brush it off. But it may be warning signs of suicide. Another reason that people miss these warning signs may be fear of intrusion. People may avoid mentioning or talking about suicide or showing care due to fear that other person will feel uncomfortable bringing up the issue, or they might intrude someone's life by mentioning the warning signs. Or sometimes people even fear that asking if they have suicidal thoughts may trigger suicidal thoughts, which is not true.
Professor Bernstein, what steps do you recommend people take when they notice warning signs of suicide in someone else?
So first, I think it's important to remember that the signs can be different in different people and cultures, and everything Dr. Chu said is absolutely right about some of the challenges with noticing these, the ambiguity, the desire to maybe minimize in the hopes that this isn't a problem. I think once we have noticed signals and we are confident or reasonably confident that we get over that barrier of believing maybe this isn't a big deal, maybe I don't have to worry about this, maybe I'm overreacting. I think reminding the person of the importance that they are to friends and family can be helpful, making sure to reinforce that social connection. I think also very practically reminders about avenues for help, such as therapy and suicide prevention hotlines and other sources of support can be extremely helpful. Part of this is normalizing the problem and letting people know that there are avenues of help. Talking to each other can actually be an incredibly helpful avenue to reduce the silence around suicide. As Dr. Chu said, one thing that people are sometimes concerned about is that talking about it will lead to an increase in thinking about it. This is not what we would recommend people try to avoid doing. Another thing that people who are suffering from suicidal ideation and from depression generally worry about is that they are a burden to others. And oftentimes they don't want to share how they're feeling for fear that they're going to burden whomever they're talking to. And so if you are noticing signals, talking to the person about it will relieve that concern over burden, reminding them that you are here because they're not a burden. You are concerned about them. All of these are things that people can do should they notice signals that lead them to be concerned to hopefully support the person in need.
Dr. Chu, a recent survey conducted by a team of researchers at Seoul National University found that nearly half of Korean adults struggle with long-term repressed anger issues. From your perspective, why are people so angry these days? And could this be linked to the country's high suicide rate?
From my perspective, people seem to often feel anger due to perceptions of unfairness and constant social comparisons. When people perceive the society to be unfair, they struggle to find reliable rules or systems that offer a clear path to success. But no matter how hard they work, they may feel nothing is guaranteed. And there often seems to be no alternative solutions or methods to achieve their goals, which leads to helplessness and hopelessness and rage. Also, people are constantly comparing themselves to others, especially through social media, who seem to have more success, wealth, or status, and there will always be someone with more of that, which also fuels feelings of inadequacy and frustration. And I think this persistent sense of unfairness and comparison can lead to deep-seated feelings of anger, not just at a surface level, but to the point where individuals feel helpless and hopeless. And while there may not be a direct link between this rage or anger and suicide. These emotional responses, particularly helplessness and hopelessness, can lead to mental health distress, which is closely associated with an increased risk of suicide.
Professor Bernstein, what measures have been taken by the U.S. government to tackle rising suicide rates? And in your view, what more should be done?
Sure. So the U.S. Department of Health and Human Services has recently come out with their 2024 National Strategy for Suicide Prevention, which is sort of a 10-year plan. This is following on previous plans that had been enacted by the government, and it has 4 facets, one of which is community-based mental health. This is about reducing stigma, having local community members connected to people, so that both people who are feeling this way see local individuals who they may trust as an avenue for talking and for getting support. It also means local community members who know their communities are going to be better at surveillance, at noticing when there are problems. These are people who live and work in the community and therefore are more likely to notice when there is a problem. There is a greater desire to include suicide prevention services as part of regular health care. This is another kind of facet in the US. It's very common at hospital or doctor visits to be asked about suicidal ideation, even when the visit has nothing to do with suicide. So someone goes to the doctor for nothing about suicide or suicidal ideation. It's not uncommon for check-ins to occur. This both normalizes the problem, gives a medical professional an opportunity to notice signals that are coming, and also just gives a person the opportunity to talk to someone who has asked how they're doing in this regard. They're also working on more research for suicide prevention and causes of suicide, and then a lot of attention to health equity concerns. So in the US, and as in many cultures, there are certain populations that are disproportionately affected by suicide, and the Department of Health and Human Services is directing work and research to focus on looking for health equity within these populations.
And Dr. Chu, just very quickly before we let you go, what is your message to our viewers regarding suicide prevention?
I would like to invite everyone who's watching this to take a part in suicide prevention. Please show care to people around you. Make a call when they show signs of warning signs of suicide. Please don't be afraid to reach out. As Dr. Bernstein mentioned earlier, social isolation is a risk factor, but also social connection can be a protective factor. So please reach out, take care of each other, and please show care to prevent further suicide in our society.
Well, suicide is a complex and deeply personal issue, but it's one that can be prevented with increased awareness and compassion, right? We should all remember that reaching out can make all the difference, and there should certainly be more open conversations about this. Thank you so much, both of you, for your perspectives.
Thank you.
Thank you.
And that brings us to the end of the show. Thank you for watching, and be sure to tune in same time tomorrow to join our conversation. Goodbye for now.